In the state of Minnesota, underrepresented groups struggle with public health disparities reflected in the availability, quality, and cost of health care. The Community Health Initiative, also known as CHI, responds by providing resources that empower community-based organizations and businesses to impact public health, social services, medicine, and medical technology to benefit the people most in need. Our mission is reflected in our stories.
I did 2 internships with the Community Health Initiative, and then I also was the program coordinator for the Community Health Initiative. The first internship I did was at Wilder Foundation, and there I worked with their caregiver services area, and I provided social work type case management to caregivers. And then I worked at the MVNA, Minnesota Visiting Nurse Agency, and I helped launch a pilot program. It was an advanced illness management program that they did, and I developed the evaluation and kind of the foundation for that program to get it started.
So presently I'm working as a summer intern with the Native American Community Clinic. They are part of an accountable care organization which focuses on improving the quality of care, patient experience, and limiting the cost of health care as well. And in particular, I'm involved with their projects to carry out quality audits as well as literature review to inform them on best practices for their chemical dependence program. The clinic serves underrepresented and minority populations, especially Native Americans. So the idea is to work on the different programs in each of these different spheres to improve the quality of care amongst their patients.
I'm interning with WellShare International, and they're a local nonprofit that works with immigrants and refugees. This internship through the Community Health Initiative has empowered me to apply my learning as it's happening. So I'm learning it and practicing it in real time. I'm getting a chance to apply the skills that I get in the classroom. I love the idea of working with women and helping them access the services that they need and just giving them tools that will empower them to lead healthy lives. Being a part of the CHI program has empowered me to be paid for the work that I'm passionate about.
Well, I think the Community Health Initiative is the foundation to connecting the university into what they want to bring into the greater community in the greater Twin Cities. And the Community Health Initiative, by bringing that younger population and getting them involved early, connecting them back to their graduate studies, be it in the School of Public Health, social work, in the medical school, it allows them to bring a level of clinical expertise out into the community. So that early involvement leads to a lifetime of involvement, and we're very proud of supporting the students in the community.
Yeah, the value of the scholarships for the medical students is that they're coming from underserved communities where they don't necessarily have the funding to be able to pay for their medical education. Well, the reason that we provide the scholarships to our second-year medical students and the students that are officers of our Student National Medical Association is that they have the passion to serve communities that are really diverse and inclusive. And oftentimes we have found that students who are coming from those backgrounds really do want and do go back and serve those communities.
The scholarship means the world to those who received it. Growing up in a family who both parents were immigrants, so I was a first generation, both college and medical school. My dad wanted me to push for what I would love to do, and that's always been the sciences. And somehow Journey took me to medical schools. I'm hoping that we'll be able to do what the program has focused on and provide what is needed in the community.
In the future, I can have a job as a project or a program coordinator creating services for immigrant and refugee communities.
The Community Health Initiative is a win-win opportunity for both ourselves as a community organization, for the students, and also for the community at large. It makes all 3 of us stronger and able to work together.
When you look at CHI and the outcome that CHI is trying to produce, it's getting students to develop their skills, to become leaders, to get out in the community and develop their networks so that they can do this work. And I think by having the opportunity to do that, we're affecting the larger community. We're having an effect on beyond the University of Minnesota campus because we're producing competent workers and professionals that can go out and do good work.
This work is done through the University of Minnesota's Office for Business and Community Economic Development. Through CHI, we offer scholarships, community internships, student consulting projects, and funding for health disparities research. The University of Minnesota's Office for Business and Community Economic Development is committed to advancing the quality of life in Minnesota's communities. The Community Health Initiative would not be possible without the partnership between Medica and the Office for Business and Community Economic Development.